So good day everyone. Today I will present the drug study. So we chose 7 drugs according to the diagnosis of the patient. So first is omeprazole with dosage of 400 milligrams 1 tab twice a day, clarithromycin 500 milligrams 1 tab twice a day, amoxicillin 500 milligram 2 caps twice a day, and these 3 are taken orally, and furosemide 20 milligrams IVTT after each blood transfusion, tranexamic acid, 800 milligrams IV PRN every 8 hours, metoclopramide, 10 milligrams IV Q8 PRN, and vitamin K ampule IVTT every 8 hours. And these are taken intravenously or given intravenously. So for the first drug is omeprazole with brand name of Prilosec. It it is classified in the proton pump inhibitors, and its action is it works by decreasing the amount of acid produced by the stomach, and it is indicated to use or manage and treat peptic ulcer disease, gastrointestinal reflux disease, gastric ulcer, Helicobacter pylori, and used to prevent upper gastrointestinal tract bleeding in seriously ill patients. So it is contraindicated for long-term use for gastroesophageal reflux disease and duodenal or ulcers. Its adverse effects include headache, dizziness, fatigue. For GI is diarrhea, abdominal pain, nausea, mild transient in, increases in liver function test. For the urogenital, hematuria and propylinuria, and for the skin rash. Now, for the nursing considerations, before we administer the drug, we should ask any unusual or allergic reaction to this medication or other medicines. And we should also monitor urinalysis for hematuria and proteinuria. And during that is we should report any changes in the urinary elimination such as pain or discomfort associated with urination or blood in the urine. We should also report severe diarrhea, and this drug may need to be discontinued. So after that, we should assess neurological status including level of orientation and reflexes and the patient's affect. We should also evaluate for CNS effects of the drug. We should also assess for respiratory status, including respiratory rate, rhythm, and we should note evidence of cough and hoarseness. Now, for the second drug is the clarithromycin under the classification of antibiotic or macrolides, and it inhibits bacterial protein synthesis by binding to the bacterial 50S ribosomal unit. And this drug is indicated or known to be highly effective in eradicating Helicobacter pylori or H. pylori, and it is contraindicated for documented hypersensitivity to the drug and history of cholestatic, jaundice, or hepatic dysfunction, and co-administration with colchicine in patients with kidney problems. So its adverse effects include confusion and spinning sensation. It also include fast or pounding heartbeats, fluttering in your chest, and for the GI, includes stomach pain, nausea, and vomiting, diarrhea, unusual or unpleasant taste in your mouth. For the liver problems, there is also loss of appetite and upper stomach pain, tiredness, dark urine, and clay-colored stools. Now, for its nursing consideration before administering the drug is we should be alert for signs of pseudomembranous colitis, including diarrhea and abdominal pain, fever, pus in the mucus and stool, and other severe prolonged GI problems. And we should also assess for allergy to the drug and what medications are taken by the patient. So during that, we should monitor rashes or other skin reactions like pruritus, hives, acne, abnormal sweating, and exfoliation. We should also instruct the patient to stick to non-caffeinated beverages while taking antibiotics, including plenty of water to stay hydrated. And also, after administering it, is we should notify the physician immediately because certain skin reactions may indicate serious hypersensitivity reaction. So for another drug is amoxicillin, which in under the classification of antibiotic and antipyretic. So its mechanism of action it binds to penicillin binding proteins in the cytoplasmic membranes of bacteria, thus it inhibits the cell wall synthesis. So this drug also inhibits the cell growth and cell division. So amoxicillin is indicated in combination with omeprazole or um, to lansoprazole to treat duodenal ulcers or eradicate H. pylori. So it is contraindicated for hypersensitivity to this drug and use of 875 milligram tablet in clients with GFR less than 30 ml per minute. So its adverse effects include reversible hyperactivity, agitation, anxiety, insomnia, behavioral changes, and dizziness. It also include diarrhea and nausea and vomiting, moderate increase in AST and ALT, and for the renal, crystalluria, and for the blood, adverse effect is anemia. Now, for the nursing considerations, before that is we should note for any hypersensitivity reaction. And we should also instruct the clients that therapeutic regimen must be completed even if symptoms subside because this is an antibiotic. So during this is clients with GFR of 30 to or 10 to 30 ml per minute should receive 250 or 500 milligrams every 12 hours, and we should monitor CBC, renal and liver function test may be taken with food. So after that is antibiotic resistance may occur if used without practitioner consultation as duration of the therapy and may not be completed. And we should also report bleeding, sore throat, rash, diarrhea, worsening of symptoms, lack of response to this drug. Next is the furosemide or known as Lasix. Under the classification of loop diuretics, these are electrolyte and water balance agents, and it it acts as to inhibits the reabsorption of sodium and chloride primarily in the loop of Henle and also proximal and distal renal tubules, and an antihypertensive that decreases edema and intravascular volume since the patient is positive also for edema. So it is indicated for the treatment of edema associated with CHF, cirrhosis of liver and kidney disease including nephrotic syndrome. It is also contraindicated to patients with history of hypersensitivity to furosemide or sulfonamides, increasing oliguria, anuria, and electrolyte depletion states hepatic coma. Now, for the adverse effect includes postural hypotension, dizziness. For metabolic includes hypovolemia, dehydration, hyponatremia, elevated BUN, and for the GI, nausea and vomiting, which is common to the patient. And for the urogenital, allergic, intestinal nephritis, and urinary frequency. For the nursing considerations, before that is we should observe patients receiving parenteral drug carefully. We should closely monitor BP and vital signs. And sudden death from cardiac arrest has been reported. So we should monitor this one. We should also assess for allergy to the drug. And during that is we need to monitor for lab tests. So we should obtain frequent blood count, serum and urine electrolytes, carbon dioxide, BUN, blood sugar, and uric acid values during first few months of the therapy and periodically thereafter. So we should also monitor for signs and symptoms of hypokalemia. So after that is we should also monitor I and O ratio and pattern, report decreased or unusual increase in the output, and we should also note that excessive diuresis can result in dehydration and hypovolemia, circulatory collapse, and hypotension. So we should also weight the patient daily under the standard conditions. Next drug is tranexamic acid under the classification of antifibrinolytic agent, and its action is it works by blocking the breakdown of the blood clots which prevents bleeding. So it is indicated for patients with hemophilia or bleeding disorders, and replacement for therapy for gastrointestinal bleeding since the patient has peptic ulcer bleeding. And it is contraindicated in patients with subarachnoid hemorrhage due to risk of cerebral edema and in patients with active intravascular clotting. So its adverse effects include blurred or loss of vision, changes in vision and confusion, migraine, headache, seizures. And for the GI is nausea and vomiting. And for the urinary adverse effects, bloody or cloudy urine. And for the skin effects, it includes itching and skin rash. For the nursing considerations, we should monitor blood pressure and other vital signs and monitor overt bleeding every 15 to 30 minutes. So we should monitor also the neurologic status of the patient, assess for thromboembolic complications, monitor the platelet since the patient is bleeding, count and clotting factors prior to the periodically throughout therapy in the patients with systematic fibrinolysis. Stabilize also the IV catheter to minimize thrombophlebitis and monitor site closely. After that is we should instruct the patient to notify the nurse immediately if bleeding recurs and in thrombolytic symptoms. So caution the patient to make position changes slowly to avoid orthostatic hypotension since this drug causes hypotension. Next drug is metoclopramide. Um, it is an antiemetic. So this is for the kanang magsuka ang patient, and its mechanism of function is it increases resting tone of esophageal sphincter and tone and amplitude of upper GI contractions. As a result, gastric emptying and intestinal transit are accelerated with little effect, if any, on gastric, biliary, or pancreatic. So it is an antiemetic action results from drug-induced elevation. So it is indicated to prevent nausea and vomiting since the patient is vomiting. So it is contraindicated for sensitivity or intolerance to metoclopramide, allergy to sulfating agents, history of seizure disorders. So its adverse effects includes restlessness, drowsiness, fatigue, transient hypertension, and nausea and diarrhea. Now, for the nursing consideration of this drug is it includes instruct to avoid alcohol and other CNS depressants, report signs and symptoms of acute dystonia, assess for allergy to the drug, and during this is report immediately the onset of restlessness, involuntary movements, facial grimacing, rigidity or tremors, and we should also assess for lab tests, periodic serum electrolytes, and monitor for possible hypernatremia and hypokalemia. Next drug is vitamin K under the classification of hemostatic. So it is a fat-soluble vitamin or an anti-hemorrhagic agent. So it is indicated to use or treat or prevent low levels of certain substances or blood clotting factors that your body naturally produces. So these substances help your blood to thicken and stop bleeding normally since the patient is bleeding. And its mechanism of action is cofactor for gamma glutamyl carboxylase, which converts the for inactive forms of coagulation factors. And this drug is contraindicated to hypersensitivity to the drug and contraindicated for patients with blood or blood clotting disorders. And this drug antagonizes the effect of coumarin anticoagulants. And its adverse effects, it includes hypotension, dizziness, tachycardia, dyspnea, cyanosis, and for the GI disorders, taste disturbance. Now, for the nursing considerations, before we administer the drug vitamin K ampule, we should ask the patient if they have blood disorders or kidney disease and liver disease. We should also assess for allergy to the drug, and we should monitor for hypersensitivity reactions, especially when administered IV. And we should monitor INR to assess for effectiveness and for the need to administer another dose. After that is we should instruct the patient to report the doctor if notice any symptoms of too much aluminum in the body, such as kanang symptoms of muscle weakness, bone pain, or mental changes. We should also observe for bleeding, which may be seen as generalized ecchymosis or bleeding from umbilical cord, since the patient is positive for ecchymosis, so circumcision site or nose or GI tract. So that would be all for the drug study of the patient in accordance to her diagnosis.